Hi, I'm Dr. Siddhan and I am the Rehabilitation Head at Saans Foundation. So, dear friends, today we are going to talk about the most important concern which we face in our day-to-day practice, what we call as the stress and stress-related diseases. So, as we know, it's an era of mental health and we are going to talk about stress. So, first, before talking about stress, let us understand that what is stress. So, stress is any condition where a person is not able to cope up with his demanding circumstances. So, it is in our practices we have seen that around 75 to 90% of patients who visit us are having problems related to stress. So, what are the problems? What we have seen in detail, what we have seen in stress. That in acute stress, we see that a lot of patients come with a lot of problems, which happens because of what we see in the increase in the production of adrenaline, which is a hormone which is produced by a gland called adrenal gland which is present on kidney, and also the cortisol. So these all produces a fright and flight response in our body. It's a kind of response which makes our body much more attentive and causes a lot of energy expenditure. So how does it affect? So adrenaline and cortisol, it has been seen that it helps, it increases the heart rate and it also, as a result of which, it increases the blood pressure. So once these response increases, so the blood flow to the muscle increase, and also it has been seen that the cortisol level which increases in our body, it causes the production of the glucose which is stored in the liver. So it causes we can say that it results in patients like diabetic patients, it results in increase in the blood glucose level as well. So stress is acute stress, stress will have immediate effects like this, like increase in the blood pressure, increase in diabetes, and causes our body to go into a tensed mode where there is a lot of energy expenditure. What we have seen in chronic stress, if like the person is having a chronic stress and a thought which is continuously bothering him for a pretty long time, so we have seen, permanent changes in the blood pressure. There is a lot of infertility problem which they face, and there is a lot of gastric problem as well. So we see that in long term they develop heart problems as a result of increase in blood pressure and lead to heart attack and other cardiac diseases. And in stomach related, what we see that inflammatory bowel syndrome is the most common kind of condition which results due to stress, and a lot of gastric regurgitation which we see. As a result, it causes peptic ulcers and all. So what do we do to, so if we see that in nutshell that all the diseases what we see in these days are because of stress related. So what do we do, like sitting at home, what you can do to just cope up with such kind of conditions? So what first thing which we call it in stress management is laugh it out. So we have seen that children laugh 300 times a day, whereas adults, they hardly laugh for 15 times a day. So laughing helps in reducing the adrenaline, the cortisol level, and help you feel good. Secondly, what you can do, you can put a rolling pin under your feet and roll your feet over it. So that helps in releasing a lot of good hormones, endorphins, which helps you feel better and elevates your mood. Another important thing which we have seen and which we tell our patients to go for a regular exercise, at least of 30 minutes of exercise regularly if it has been done. So it produces a lot of good hormones in our body and helps us elevate our mood. Eating good is another important thing. We should have a lot of antioxidants, colorful veggies like bell peppers, zucchini, broccoli, leafy vegetables. So these are full of antioxidants. So they causes a good, you can say, they help in reduction of the free radicals in the body and help give the cells a good environment for nutrition for the growth. Another important thing what we call is breathe it out. Why breathe it out? Because the more you breathe out, then the more you can take in oxygen. See, oxygen is very important for brain. It's for normal functioning of brain, and as a result, when you breathe in deep, so you reduce your heart rate and you improve the oxygen supply to your brain. So as I was saying that breathing is a technique which we are following here, and we are teaching a lot of patients a lot of breathing techniques, mind breathing techniques, and I'll be coming across with those techniques as well in my other videos. Coping is something, it's a triangle which we talk of. Like the thoughts will result in some form of feelings, and the feelings might be accordingly, like according to your previous experiences, it might be good, it might be bad. So some certain feelings will cause some behavior pattern. So understanding the root cause of the thought and understanding how you should behave, how you should feel accordingly, and what is the other side of it is very important. So your professionals might also help you to deal with and cope up with such kind of conditions. So this is it for today. I'll be talking about more and more techniques in my further videos. Stay tuned, stay connected. Thank you.